Well, in your health headlines tonight, the CDC says that there's a rising number of children being diagnosed with autism.
In response, Health Secretary Robert F. Kennedy Jr. has announced this push to study the disorder and what causes it, with the National Institute of Health saying they are going to create a so-called autism registry.
Is this going to happen, though? That's the question. WCNC Charlotte's Megan Bragg verifies.
The biggest question is, what is the Autism Registry and what personal information could it have? To get answers, we went to the CDC, the National Institute of Health, the Department of Health and Human Services, and the Autistic Self-Advocacy Network. HHS Secretary Robert F. Kennedy Jr. says the department will announce a series of studies in the coming weeks to identify environmental factors that cause autism.
The issue that we know is genes don't cause epidemics. You need an environmental toxin. And we're going to look at all the potential culprits. We're going to look at mold. We're going to look at food additives. We're going to look at pesticides. We're going to look at air and water and medicines. So, we're going to look at ultrasound.
Kennedy's comments come after the release of a CDC report that found 1 in 31 children in the United States are diagnosed with autism spectrum disorder by their 8th birthday. However, it did not identify a direct cause for the disorder. Dr. Zach Warren, one of the authors of the CDC report, offers more insight.
We have data that a certain percentage of some types of autism can be clearly explained by genetic differences. We have other evidence suggesting that actually it's the complex interplay of environmental factors.
The National Institutes of Health's top official says the agency is creating a new national disease registry for autism, compiling private medical records from a number of databases to give HHS in the effort to study autism. However, the Department of Health and Human Services says they have no plans to create an autism registry. As questions remain about how data will be collected and stored, privacy concerns continue. The Autistic Self-Advocacy Network issued a statement saying, in part, quote, "At present, so little information has been released about this plan that basic questions about how it will work remain unanswered." However, they say if personally identifiable information is removed, this is normal practice, and that right now there is no indication that the database will target individual people. Kennedy says he plans to provide more autism data in real time, adding that he'll direct resources to study environmental factors, exposures, and external factors. With your Verify, I'm Megan Bragg.